of course, we will give analgesics if there is pain, and there is no pain. And of course, I hope you all know pain is the most common cause of removal. We can remember it by the mnemonic PR. Pain is the removal cause, and bleeding is the most common complication of IUCD. So here, because it is only spotting, we need not to remove IUCD. We will only give iron supplement and reassure the lady. The same is written in Park textbook of PSM, which is the reference standard textbook also, that bleeding is most common complaint, and if if the bleeding is small or only spotting is there, then what we do is we will give iron tablet 3 times C. You can see this line written here. The patient who is experiencing spotting between periods settle within 1-2 months. So we need not to worry because it will settle in 1-2 months. And the patient who is experiencing the bleeding episode should receive iron tablet, ferrous sulfate 200 milligram 3 times daily. This is something much higher than what we give even for the treatment. And after giving iron tablet and all, it will settle down in 1-2 months. So we should not be worried. And if the copper device is there, there is less average blood loss. And in hormonal devices like 3rd generation IUCD, Mirena and Progesterone, there is much lesser blood loss. Now, the Park has further written that if the bleeding is heavy or persistent, and if the patient develop anemia despite iron supplement, then we will remove IUCD. So IUCD is removed only if the bleeding is very heavy, persistent, and anemia is there. Otherwise, we will not remove it. Okay. Plus, we can also change the copper devices. If there is some spotting bleeding, we can change it. Like Lipley's loop will cause more bleeding. Then there is copper device. 2nd generation will cause lesser as compared to the 1st generation Lipley loose. And 3rd generation will cause least bleeding. And as I was saying, pain is the second common side effect, but most common cause of removal is pain. Now, coming to the next question, it was a numerical based question being asked 2-3 times already, but let me tell you, the FMG question looks simple, but it was really twisted this time. So in this question, they are asking neonatal mortality rate, and I hope you all know the formula for that. That in neonatal mortality, we will write down the live birth below, and we will multiply it by 1000. And in the numerator, we will write all the death that occur in first 7 day plus 7 to 20 days. So death in first 28 days will be counted as neonatal death. Now, what is the live birth here? So for the live birth, the total birth is 450, but still birth is 50. So out of that 450 birth, we will subtract the still birth, and it will come out as 4000. And death in the first 28 days, if they ask, 0 to 7 is 150 and 7 to 28 is 50. So 150 plus 50 we will do, and finally it will be 200 by 4, because this 3030 will cancel out, and 200 by 4 will come out as 50. So neonatal mortality will be 50. If they ask perinatal mortality in the same question, perinatal mortality will also include those who are between 22-week stillbirth, who are also stillbirth. So stillbirth is 50, and first 7 day. So first 7 day here death is 150 divided by 4, because again this live birth is 4000, so it is 4000 into 1000, which will cancel out. So if they ask perinatal also in the question, the answer will remain the same, 50, because this stillbirth is also 50, and death between 7 to 28 is also 50. So this data remains same for both perinatal and neonatal. In this question, it will be 50 only. Coming on to the next question, this question is based on crude birth rate. Crude birth rate and crude death rate both are measured at mid-year population, which is 1st of July. And here we can see that the total live birth are 500. The mid-year population on 1st of July is 30,000, and we have to multiply it by 1000. So if you multiply it by 1000, this 30 will cancel out. 500 by 30 will be there, or you can simply say 50 by 3 will be there. If it is 50 by 3, it is definitely 16.7 which will come out. It's roughly 16 will be 48, so 16.7. We can do it without calculation. That's why they ask. But of course, it's not so easy because we have left math 6 years back, but still we can guess the answer will be more than 10. So it was 16.7. Now, the third question is on the formula of dependency ratio. And I hope you all know in dependency ratio, we write children 0 to 14 year plus population more than 65 year above. These are the people who are dependent. And on which group they are dependent? They are dependent on earning population, which is between 15 to 64. So in our story, we have to find out that how many people are more than 65 or less than 15. So 69 is more than 65, of course, and 5-year grandchild is again less than 15. So 1 0 to 14 child and 1 old age more than 65. And how many are between 15 to 64 year? So between 15 to 64, one is the Mrs. 58 year and one is the son 30 year with the wife 28 year. So when they are calculating dependency ratio, there is one less than 15 year, one more than 65 year, and there are 3 people which are between 15 to 64 year. And we have to multiply it by 100. So it will be 2 by 3 into 100. So it will be come out as 66.7% or 0.66. If you multiply by 100, it will be 66%, otherwise 0.66. And I hope you all know that currently India is in the phase of demographic bonus. There is 2 things, demographic bonus and demographic burden. Bonus can also be called as dividend. Demographic bonus or dividend is there when the dependency ratio decreases. That is a good news for the country. Less dependent people. And how dependency ratio decreases? By decreasing fertility rate. So if both fertility rate and dependency ratio decreases, we will have less children less than 15 year, and where there will be demographic bonus or demographic dividend. But when the country will be under the phase of demographic burden is there when dependency ratio increases, and dependency ratio increases by increasing fertility rate. So these 2 things they keep asking. Now, in this question, they have asked you to calculate relative risk for the given situation. And the formula for relative risk is incidence of disease in exposed by incidence of disease in non-exposed. So here, this vaccinated people are exposed and non-vaccinated are non-exposed. And if you add them, here exposed is also 100, non-exposed is also 100. So whenever exposed and non-exposed are equal, we can find relative risk directly by the formula A by C. And A by C, if you do here, it will be 6 by 12, and 6 by 12 will definitely be half or 0.5. So the correct answer is 0.5. But in some cases, this exposed and non-exposed are not equal. In that case, the relative risk will be 6, and then we will add these 2. If you will add these 2, it will be 100 divided by 12, and then we will add the non-exposed, 12 plus 88. So that will also be 100. And you can see the 100 will cancel out, and finally answer will be 0.5. But I was just telling you the exact formula, which is A by A plus B divided by C plus D. This is the real formula, but most of the time A plus B and C plus D are equal, so they cancel out, and therefore it becomes simple to calculate. Like here, it will be 0.5. Now, till which maximum time IUCD can be inserted in a postpartum woman? And some of the teachers have wrongly taught it as 48 hours. But if you look at the Park textbook, the Park textbook is writing that we can insert IUCD within 10 days of beginning of menses. This is one time, within 10 days of beginning of menses. Then we can insert it immediately postpartum, and they are not writing 48 hours, but they are saying we can insert it postpartum. during first week after delivery. But if you insert it during first week after delivery, there is higher risk of perforation during this time. Plus, there is also higher expulsion rate which is possible. So what is the convenient time they are writing? 6 to 8 weeks after delivery, post-perpural insertion is a convenient time which we can do. And they have written that the advantage of doing 6 to 8 weeks is we can also do follow-up examination of the female, because till 6 weeks we consider maternal death. Second thing we can do is that we can ensure whether the child has received all the 5 vaccine first dose at 6 weeks or not. So if they ask maximum answer will be 8 weeks, because it is written 6 to 8 weeks after delivery we can insert. So till what maximum time IUCD can be inserted in a postpartum woman? Correct answer will be 6 to 8 weeks or 8 weeks, but because 8 weeks is not in the option, so we can safely take 6 weeks as the maximum time where IUCD can be inserted after delivery. And anyway, why it is 6 weeks? Because if there is non-exclusive breastfeeding means mother is also giving outside milk like powder milk or cow buffalo other milk. In case of non-exclusive breastfeeding also, the lactational amenorrhea will be up to 6 weeks. That means till 6 weeks there is no chance of pregnancy, so we can safely wait till 6 weeks and insert IUCD. But if there is exclusive breastfeeding, in case of exclusive breastfeeding, the lactational amenorrhea can continue till 3 months maximum. Okay, so till 3 months we don't need to give anything, but after 3 months we need to give progesterone only pill. And in case of non-exclusive breastfeeding, after 6 weeks, we need to give progesterone only pill. So 6 to 8 weeks we can wait and then we can give IUCD. I don't think we should insert IUCD after delivery anyway, because it will lead to perforation, higher perforation and higher expulsion written in PARC also. Now, most common cancer in women in India, some of the students, they tick wrongly it as cervix, but the correct answer is always breast cancer. And it is clearly written in PARC textbook, again, I am referencing. Even if they ask both sexes, suppose I asked most common cancer in the world or most common cancer in India, don't write lung cancer in world also. Always most common cancer in both sexes will be breast. Now you will say, how sir? Lung cancer of course will occur in male, female both, but breast cancer will more commonly occur in female only. The reason is this formula, that prevalence is equal to incidence into duration. So we all know that breast cancer people suffer for 10, 15, sometimes they survive till 20 years also. So the duration of disease is much higher in breast cancer. But lung cancer people, they will survive till 2-3 years, and within 2-3 years, most of them will die. So at any time, let's say in 2024, if you are counting the number of patients of breast cancer patients will be much higher. Their prevalence will be much higher. Why? Because they are surviving for 10-20 years, so their counting will be done at any time, their count will be higher. But lung cancer, they can have higher incidence, but they are surviving less, so their final prevalence will be less. So remember, if they ask most common cancer of the world, most common cancer of India, in both cases, answer will be breast cancer. Now, coming to female, which was in the question, in case of female also, you can see clearly it is written that breast cancer is most common, cervical cancer is second number. So do remember this point which I am telling. Most common cancer of world or female or female, they ask anything in this, answer will be breast. But if they ask most common cancer of male, and in this case they ask India, then in India we have ऊंचे लोग ऊंची पसंद मानिक चंद, है ना, बोलो तो बोलो जुबां केसरी. Lip and oral cavity cancer is more common in India. But in case of male of world, they are smoking too much, so male of world it will be lung cancer. Okay, so most common cancer of world or female of world or female of India, again whenever they ask world or female, answer will be breast. When they ask male specifically, in India, lip cancer, oral cavity, and in world, lung cancer. For lip cancer, they have asked, we will put 2 fingers, one inside, one outside, and do the screening. If the swelling is rough, it is cancerous. If it is smooth, it must be probably be sebaceous or some other cyst. Okay. Now, true about Anemia Mukt Bharat program. Of course, Anemia Mukt Bharat, we do deworming not only for anemic female, for non-anemic also. IFA tablet is given, but not for 100 days. It is given for 180 days. And we start giving IFA tablet after first trimester. In the first trimester, we only give folic acid. And after first trimester, we give it for 6 months of delivery and 6 months after delivery also. So the correct answer is C. We give it for 180 days before delivery, 180 days after delivery, 1 tablet per day. And of course, the dose is 60 milligram iron plus 500 microgram folic acid. This tablet, red color tablet, is given 180 days before, 180 days after delivery also. So that is there. And we do not start it from first trimester. So correct answer is C. Now, they can also ask what are the benefits of Anemia Mukt Bharat. So one is IFA, second is albendazole, third is behavior change communication, BCC. Fourth is we focus on food fortification. That means we try to add folic acid and iron in the food. Third is we will do digital HB measurement and follow up of pregnancy, especially high risk pregnancy, and maintain digital dashboard of country level. And last is we focus on other cause of anemia as well. So these are the 6 intervention. I hope you all know in anemia there is 6 into 6 into 6 strategy. बड़ा ही छक्का program है. First 6 are the beneficiary people who will get the benefit. Second 6 are the intervention. And to implement this intervention, there are 6 institutional mechanism by which we implement it. Okay. Orienta tushu tushu chuchu gambusi, susu gambusi, tushu tushu gambusi is transmitted by which vector? It is transmitted by trombiculid mite. Trombiculid mite. And this mite is different than the itch mite which transmits scabies. So mite, we have revised it in entomology that mite transmit 3 things. We can remember it by the mnemonic RSS or by the mnemonic PSM sada hua, PSSM. First is rickettasial pox. Okay, R for rickettsial, P for pox. Second is the scrub scabies, and third S is the scrub typhus. So this any of the 2 can be used as mnemonic. You can take PSM as a mite or RSS as a mite, but remember the 3 diseases transmitted by mite, which are rickettasial pox, scabies, and scrub typhus. Now, ideal antenatal visits. So many of the students say they did not ask ideal, they ask minimum. So no matter what they ask, let's read this topic completely. First thing is, this is directly from Park again, that mother should attend antenatal clinic once a month during first 7 months. So this is 7 in first 7 months. Then twice a month during the next month. So 2 during the next month. So how many months are there? 7 plus 1, 8 months is done. And pregnancy is of 9 months. Then thereafter once a week. So once a week last month. And last month there will be 4 weeks. So 7 plus 2 plus 4. Total will be 13. 13 is the ideal number of ANC visit which should be there. This is the ideal. But in India, how many visit? They say minimum visit, 4 visit. And they have written the duration. One is 12 week. Then there is gap of 2 week, 14 to 26. Again gap of 2 week, 28 to 34. Again gap of 2 week, 36 week and term. So that means total 4 visit is there. Ideal is 13. 4 minimum is in India. And if they ask it about WHO say there should be 8 minimum. So whatever they ask, we should be ready for it. 13 ideal, 4 minimum India, 8 minimum WHO. Okay. Next question is from the image of Lipley's loop. है ना, मैं कहता भी था कि ये ऐसे सांप जैसा दिखता है, इसके आगे फन निकला होता है. It's like a snake with this outer part also coming out like that. That is Lipley's loop. And the problem is Lipley's loop, it has a very high expulsion rate. ये लूप से निकल जाता है, and because of this they make it, coated it with barium sulfate to make it X-ray visible. Okay, so this is the various type of IUCD given in PARC. They can ask other IUCDs also. So let's remember, see all the images. One is this Lipley's loop. Second is copper T 200B, which is very much similar to 380 AG. If it is 380 AG, there will be two brown thing like this. Otherwise, it will not be there in 200. And what is this 380? 380 is the area of copper T in millimeter square, not in centimeter square, millimeter square. Now, then Nova T is a bit more flexible with a drop-like appearance at the end. That is Nova T. If it is 7 shape, it is copper 7. But many a time they ask this thing, multi-load 375. And all except Lipley's loop, all of these IUCDs except Lipley's loop, these all IUCD are second generation, because second generation are having metallic wire, so you can identify them. Third generation have hormone in it, and hormone cannot be contained without plastic. So whenever they will give third generation like Progestasert or levonorgestrel IUCD or Mirena, they will cover it with plastic. Progestasert protect for 1 year, Mirena protect for 5 to 10 years. These are the protection time third generation, which will have lesser bleeding as compared to second generation. I hope you will remember the images. First generation will be Lipley's loop, okay, with high expulsion rate and double S-shaped. So patient with rheumatic heart disease is given. There many students say there is no patient, there is a child of rheumatic heart disease who is being given benzathine penicillin to prevent. Child is of sore throat or streptococcal infection, and we want to prevent RHD. So if they want to prevent RHD, then it will become chemoprophylaxis. And chemoprophylaxis come under primary level of prevention or a specific level of prevention, then answer will be primary. But if they remove the word child and they ask patient is given rheumatic heart disease, it's for rheumatic heart disease injection of benzathine penicillin, then it is a treatment, and treatment come under secondary. So do remember, secondary is for all screening test and treatment. Basically, secondary means early diagnosis and treatment, and early diagnosis is by screening test. So sometimes they ask, a son took his hemiparesis father for checkup, what is the level of prevention? So when the son took hemiparesis father for physiotherapy, then it will be tertiary. But if he is taking for checkup, checkup is for early diagnosis, answer will be secondary. Even if I am taking BP of a 10-year-old kid or a healthy adult, purpose of screening test is early diagnosis of hidden hypertension. So no matter in which person I am doing screening test, all screening test and treatment will be secondary. And primary means, you can see it from PARC directly also. Primordial include all the things like health education and lifestyle changes, physical exercise, eating pattern, and smoking prevention. These are primordial before appearance of risk factor. Primary is action taken prior to the onset of disease, like chemoprophylaxis, isolation, quarantine, minus desk, Anemia Mukt Bharat, condom, all of these are primary. Then when they talk about secondary, secondary is the action which halt the progress of disease and its incipient stage, prevent complication also. It includes screening test and adequate treatment. So do remember, all the screening test and treatment come under secondary. When it comes to tertiary, tertiary means disability limitation. So they can give you an image of a person with filariasis or elephantiasis, and they will say the taking care of the leg of this leprosy or filariasis patient will come under which condition, which level of prevention. So that will be disability limitation or tertiary prevention. Now, next question was, in a new onset of morbid disease, what the question, some students say that the question was that morbidity is increasing. So if morbidity is increasing, basically morbidity means for how long someone is suffering. So morbidity means is increasing means there is increase in duration of disease. And by the formula of this simple formula, which we did again, prevalence is incidence into duration of disease. Whenever they will raise the duration of disease, by raising duration of disease, one thing is sure, prevalence will increase. So if morbidity is increasing, it means prevalence is definitely increasing. Incidence increasing or not increasing, it depends on preventive and social changes. Incidence does not depend on drug. So if they say there is a drug which increases survival, like BP and sugar drug, they increase survival, but they are not curing the disease. So if they are not curing, just increasing survival, then incidence does not depend on drug. Incidence will remain almost same. But with that drug of diabetes and hypertension, people are not dying, so they are suffering long, and because they are suffering long, their morbidity is more, and because their morbidity is more, so prevalence will be more. So always remember, whenever morbidity is increasing, one thing is sure, that prevalence increases. We are not sure what will happen to incidence, but prevalence increases for sure. So now let's look at the option based on this. First is prevalence not related to incidence. How can it be correct? We just read the formula, P is equal to incidence into duration. Prevalence decreases with increase in incidence. Again, it cannot be correct because incidence and prevalence both are directly proportional. So this is also not correct. Prevalence increases with increase in incidence. Of course, this is correct. But I am damn sure this is not the correct option which come in the exam. In the exam, the options must be different than this. I am really sorry for unable to get the correct option, but even you cannot many a time remember it, because there are exam is in 2 sessions, very long, tiring exam. And since morning you wake up 5-6 a.m., then you go to give first session, then there is a lunch break of 2.5 hours, then there is second session, and after second session you are so much tired you cannot recall. Because you go for party and relaxation, and no one can recall after relaxation, of course. And because of that 2 session thing, the options do not come well. And that's why I always insist on all my friends who are going to give FMG, do 5 years of NEET previous year for sure, and 2-3 years of INICT recent year at least. This 5 years of NEET will used to occur in past in 1 session, so they will have better recall. So that's why that is better. Now, many of you are writing some thing. Utkarsh Utpal is saying true recall. Thank you, Utkarsh, for appreciating. But I know I am not 100% correct, but I'm trying for it. For louse, Chota Doctor is suggesting PERT mnemonic. Yes. Louse or head lice transmit 4 disease: pediculosis, epidemic typhus, relapsing fever, and trench fever. Trench fever is also known as Quintanilhac fever. So you can remember it by the mnemonic PUT. Why? Because if you kill lice, that also produces the sound of PUT. So the mnemonic is also PUT. And a pediculosis, epidemic typhus, relapsing fever, trench fever. So like that, you can remember 2-3 entomology things and you can remember it. Yes, Chota Doctor, remember that. Lipley's loop will be a snake with hus coming out. Crippling fluorosis seen at what level? This is one question which I also never taught in any of my class. This was a direct line from Park, and I'm sorry I was not aware that they will ask this line. They say that in the fluorosis thing, the dental fluorosis occur at 1.5 milligram per liter. So dental at 1.5. Then, and they have given the image of dental fluorosis. Skeletal fluorosis occur at 10 milligram per liter. So it was one of the line which I should have taught, but I was not sure that they will ask it. Do remember, dental is at more than 1.5 and skeletal is at more than 10. Okay. But skeletal fluorosis occur at 3 to 6. But if it is more than 10, then crippling fluorosis will occur. So that means the normal fluorine concentration is 0.5 to 0.8 milligram per liter. This is easy to remember because chlorine is also almost the same, 0.5 to 0.7. 0.5 is the minimum residual chlorine that should be there. Fluorine 0.5 to 0.8, so almost same. But if the fluorine is less than 0.5, as we have read, it will lead to dental caries. Daant sad jayenge. Dental caries will be there. if the fluorosis is more than 1.5, it will lead to dental fluorosis, mottling of teeth. If the fluorine is more than 3 to 6, it will lead to skeletal fluorosis. And if the fluorine is more than 10, then it will lead to crippling fluorosis, which was asked in the exam. So this is the thing which you should remember. Next question, free residual chlorine level after chlorination of well. So the free residual chlorine should be 0.5 because minimum chlorine should be 0.5, and it is after 1 hour because this 1 hour is the contact period in which bleaching powder releases different ion, and those ion, they do dishum fight with the bacteria of the water and kill them. So in the contact period, when bleaching powder releases ion, what is the most important ion of bleaching powder? That is HOCl minus ion, hypochlorous ion, the one with rus juice will kill maximum bacteria. So hypochlorous ion kill 85% bacteria in this 1 hour of contact period. Before this 1 hour of contact period, we use Horrocks apparatus to estimate the chlorine demand of water. Chlorine demand means how much bleaching powder we will put in the water, which will kill all the bacteria. So first we estimate chlorine demand by Horrocks apparatus, in which starch iodine is indicator. Then we give 1 hour of contact period, and after 1 hour of contact period, we check out how much chlorine is left in the water, that is residual chlorine. If it is 0.5, then it's okay. If it is less than 0.5, we need to do chlorination again. And this residual chlorine is decided by which instrument? Chloroscope. Chloroscope decide the residual chlorine, left out chlorine after 1 hour of contact period. So the correct answer is definitely option A. Now, the next question is heart of sewage disposal plant. So when we discuss septic tank, in septic tank there is 2 chamber. In this 2 chamber, anaerobic digestion of fecal waste occur. And from this 2 chamber, there is a pipe which goes out in the subsoil. In this subsoil, there is aerobic digestion of waste. And if you have seen the septic tank in your home, formation of septic tank during construction of your home, you might have seen that they take out a pipe and dig it in the nearby area. That is aerobic. For aerobic digestion, this subsoil is there. And this subsoil, or where aerobic digestion occurs, this is known as aeration chamber. And this aeration chamber, this is known as heart of septic tank. Why it is heart of septic tank? Because this aerobic digestion is most important for all the spores or fumes which comes out. This disposal is needed. So heart of septic tank is aeration chamber. So do remember, heart of sewage disposal plant is aeration chamber. Before this, they have asked about deep trench latrine, which is the best way of disposal of fecal matter in a camp area. And if you are camping, let's say 10,000 people are camping, then we need 1 acre of land for preparing this deep trench for fecal disposal. But this time they ask it from septic tank. And this is the septic tank. Of course, they have asked in one time that what is the depth of septic tank. So the depth of septic tank is 1.5 to 2 meter, above which there is liquid depth is only 1.2 meter, and air space is 30. So 1.5 to 2 meter is the depth of septic tank. Second thing is in the septic tank, how the work occur. So first of all, a sludge means the solid part, they deposit at the bottom. And scum is the frothing white part which come at the surface. Okay, and then there is anaerobic digestion in the septic tank. The sludge is reduced in volume by anaerobic digestion, and after this liquid and gases are there, principally methane which is produced, that rises to the surface. These methane form the effluent, and this effluent have bacterial cyst, helminthic ova, organic matter, solution or fine suspension. This effluent is allowed to go in the subsoil, which is connected by open jointed pipe and at 90 centimeter around, they will dig a small pit of around 90 centimeter and it let them percolate in the soil. So this is the aeration chamber, which is the most important. Organic matter is digested in it, oxidized in stable end product. And for aerobic oxidation, this aeration chamber is there. So this is how septic tank work. There is sludge formation in the septic tank chamber, anaerobic digestion occur, sludge form, scum come on the fourth in the upper part, and that scum and spores, they go to the aeration chamber where aerobic digestion occur. Okay, so that's why we need to do desludging every 1 year. This is what they can ask in the next exam. We need to remove that sludge at least once a year so that septic tank can work properly. Now, there were some more questions on this topic, okay, which I would like to show to you, of course. And like this was one of the questions. A nutritionist concluded that those who consume ice water or iced tea in the gym, they have, let me put it in the notability properly. So those who consume ice water, they have lesser, more weight loss if you consume ice water in the gym. So what does it suggest? Does it suggest direct association, indirect, spurious association, or does it suggest relative risk? And these were the 4 options being suggested by the students. So let's come there to that question. These were the one question. This was the heart of septic tank which we discussed. Okay, we will let's come to that question. Then we will discuss the other one. That was a very interesting question being come. This was again a topic being neglected by us usually, but they ask it. Okay. Just 1 minute. Sorry for this inconvenience. Yes. They found that we all know that by doing exercise, there will be weight reduction. So weight reduction is the outcome, and exercise is the exposure which is causing weight reduction. Now in this story, enter the cold water or iced tea or cold water, cold iced tea or cold water, just let's say. Okay, so this cold iced tea or water has also been found to reduce the weight. Okay, and exercise is also causing weight reduction. So this cold ice water is reducing the weight. This is which type of association? See, spurious association means wrong association or accidentally found association. Like they have given this example in Park textbook that it was found that the home delivery has death rate of around 5.1 death rate, but hospital delivery have death rate in an area, it was found 22.1 death rate. So they concluded that, does it mean that home delivery is safe? Because home delivery has less death rate and hospital delivery has more death rate. No, it doesn't mean that home delivery is safe. Only thing is that hospital delivery usually, and in older time, complicated cases used to go to hospital more. And those cases who do not complicate, they will be at the home. So because complicated cases are going to hospital more, so the death rate will be more in the hospital. Second thing is, if any death occur at home, in older day, it used to go unreported. But if any death occur in hospital, they used to report it. So complicated case and more reporting is causing more death, causing higher death rate. It doesn't mean that hospital delivery is bad. So this type of association is spurious because it wrongly came. Now, what is direct association? Direct association means direct association is also known as causal association. Direct or causal association. Something is directly causing the disease. For example, streptococcal infection is directly causing sore throat. Streptococcal is directly causing rheumatic heart disease after some time. So these are direct causal. And a very good example of direct causal is what Koch postulate gave us, that if we have to confirm a disease, then we have to isolate the bacteria from the person, and then the same bacteria, if inoculated in someone else, the same disease should occur. Although Koch postulate is also not accepted nowadays, because sometimes we cannot find TB bacilli in mostly, let's say, HIV patient and all, still there is TB. And this is the same example given in PARC. So direct or causal means pathogen is directly causing the disease. When they ask about indirect association, which was one of the option, indirect association is in the form of two things. It is in the form of effect modifier and confounder. There are two things which is causing indirect association, which is the correct answer of this question also. What is effect modifier? Effect modifier is something which is only related to outcome. Effect modifier is not related to exposure, only related to outcome. Like exercise is not associated with drinking iced tea. And you will not believe it, but I used to do some exercise. And I joined a gym, went for 5 days in 5 months. I was very consistent. So I never drink cold tea or iced tea there. So it is only related with weight reduction, not with exercise. So it is an effect modifier. But if someone is related to both, then it will become confounder. And a very good example of indirect association is given in PARC textbook. Indirect association example is, two examples they have given. One thing they have given is that it was found that people with high sucrose intake in drinks, let's say who drink more tea, drink more coffee, they have more heart disease or heart attack. So why this is more? Because they used to smoke cigarette more. That's why they are drinking more tea. Because of the smoking habit, they are taking more tea because when they want to take smoke, they also take tea with it. So smoking is causing more tea, more sucrose, and smoking is also causing more heart attack. So this smoking is a confounder because it is related to both. But let's say if I write here the tobacco, if I write here alcohol. So alcohol is something which is only causing heart attack. Alcohol is not associated with tea or coffee. You cannot see someone drinking 1 peg of alcohol, 1 peg of coffee. So alcohol become effect modifier and smoking become confounder. And both of these, effect modifier and confounder, they are example of indirect association, which is not directly causing the thing. So in that story also, the iced tea or the cold water was indirect association. So the correct answer was, of course, indirect association, which was one of the options given in the exam as the student told in the recall. Now, if you convey message to community that is passively instilled against thinking or that will inhibit thinking, don't let people to think freely and just act based on their emotion. That is health propaganda. Propaganda is emotion based and reflexive. Reflexive means it is not after thinking, but health education is reflective. Reflective means we think first, then act. That is health education. But when we are acting without thinking, that is propaganda. Like all the communal violence, communal violence or mob lynching, mob violence, these all are propagandas. These all are emotion-based reflexive. It doesn't let us think whether what we are doing is right or wrong. Because the same mob violence occurred in Kyrgyzstan, and we were saying that it is wrong. What is happening in Bishkek is wrong. But what we Indians are doing, we are supporting many a time those mob violence and mob lynching. So if we are supporting that, then how can we say this is wrong? Because both of these, in what happened in Bishkek was also propaganda. What is happening in mob lynching and communal violence is also propaganda. And we should be using our brain and not just, because propaganda, what they do, they inhibit the thinking. So that is propaganda. I hope it is clear. Remember, reflective is education, reflexive is propaganda. Now, there was a question on growth rate. The question was, they gave the birth rate as, let's say, 13, suppose, and I don't remember the exact data, and suppose they gave the death rate as, birth rate suppose they gave 20 and death rate they gave 7. So this is the data of India. So they ask, what is the growth rate? What is the growth rate? If birth rate is 20, death rate is 7. Option A, will it be 13? Option B, will it be 1.3? Option C, will it be 2? Option D, let's say, will it be 1? Like that. So we all know growth rate is in percentage. Okay? And growth rate is always birth rate minus death rate. So if you do birth rate minus death rate, simple thing is 20 minus 7 will come 13. So it will look like the answer is 13. But no, my dear friend, there is one thing which we need to know. Birth rate and death rate are always per 1,000. 7 per 1,000. And growth rate is in percentage, matlab growth rate is in 100. Percentage decide the things in 100. So when we are measuring growth rate or annual growth rate, which was in the question, annual growth rate and growth rate, they are the same thing. In both of them, we have to divide it by 10. Then answer come. So actually the growth rate is 20 minus 7 by 13 by 10. 20 minus 7 by 10, or 13 by 20 minus 7 will be, 20 minus 7 will be 13. 13 by 10. 1.3 will be the answer. Why we are dividing it by 10? Because birth rate and death rate are in 1,000. They are in 1,000. And growth rate we have to take in 100. So when you divide 1,000 by 100, we need this. We need to remove the 10 thing which is there. So always growth rate is in percentage, and when we divide birth rate minus death rate, we have to divide it by 10 to get the correct answer. For example, according to this thing, the growth rate in 2020, it is written in PARC for India, is 1.2. 1.2 is our growth rate right now. And if it is 1.2, it takes around 70 years to double the 70 to 90 years to double population. That means after 70 years from now, maybe in 2095, we will be able to double the population. But by that time, our growth rate will further decline. And in next 20 years, India is going to be in a declining phase. And just in 5-10 years, we will become stable, and then we will also start declining after 20 years like Europe. So this is the growth rate, which is always in 1.2 like that. If the growth rate is more than 2, growth rate more than 2 is known as explosive growth rate. Bum phat gaya. Now people are now everywhere. Explosive growth rate will be there. Country will keep doubling itself very quickly. Okay. So the answer is 1.3, not 13, because of that. That's all they have said, but there was some more question which I missed in the above part. So let's do those questions which I was unable to do there. One question was this. Let me come all this question. Yeah. We have done this Lipley's loop thing. It is generation 1. Patient with rheumatic heart disease. If it is patient, it is secondary. If it is child who is receiving it for prevention, it is primary. We have done that. We have done this morbid question, crippling fluorosis question. Heart of sewage plant is aeration tank. We have done that. IT-based web portal for tuberculosis is Nischay. Nischay is UPT kit for pregnancy. To decide it separately, there was a student in Philippines. I was taking the class. He suggested me that, sir, in Nischay, S come first. And S also stand for sex. And sex lead to pregnancy. So the pregnancy thing will have S coming first. Nischay. And anyway, Nik means no. Chay means loss of body. And they call TB as Chay Rog. So Nik Chay is the web portal for which we report and follow up TB case. 99 dots is also a program regarding TB. When the patient is eating the tablet, there is secret phone number hidden behind the wrapper. They have to give a missed call on this number. It will tell whether the patient is eating TB drug properly or not. So it is to confirm compliance to ATT, compliance to the TB drug. Whether TB drug is eaten well or not, we use 99 dots. And there is one more thing, Nikust. Nikust we use for leprosy. Because Kust Rog is the word they use for leprosy. Okay. Next question is population covered under urban PHC is 50,000. And there are, see, first of all, there is MAS, Mahila Arogya Samiti. This Mahila Arogya Samiti, they report to USHA. USHA is at 1,000 to 2.5 thousand, roughly at 2,000. USHA report to urban A&M, which is at 10,000. Urban A&M report to urban PHC, which is at 50,000. And 5 urban PHC report to 1 urban CHC, which is at 2.5 lakh. Urban CHC is 30 bed, but in metropolitan city it is 100 bed, and we can open urban CHC near district hospital or medical college, because the serious patient will go to district hospital, medical college, less serious patient will go to CHC, and then after CHC there is medical college. So we can see it for ourselves that there is no urban sub center is there, only urban A&M report to directly to urban PHC. So this is the National Urban Health Mission which is there, which you should know. Now goals of MMR and IMR. MMR is 70. IMR goal is not in Sustainable Development Goal, but by 2030 we have to achieve it to 30. So this is for MMR, IMR. Other than that, in SDG, Sustainable Development Goal, they have target for neonatal and under 5 mortality rate. Neonatal should be less than 12 per thousand and under 5 should be less than 25 per thousand. There should be less than 1/3 reduction of premature cardiovascular death and half reduction of accidental death. This accidental death is by 2020, it should be reduced to half, but rest all should be achieved by 2030. Next question is definition of blindness is less than 3.6, less than 3/60 with possible correction, and this is also known as social blindness. Less than 3/60 with available correction. When you come to Indian classification, we can remember it by the mnemonic LESMA, not lesbian ma, choti ma. L stand for low vision, which is less than 6/18. Economical blindness is E, and economical blindness is less than 6/60. Social blindness, which we just read, is the real blindness, less than 3/60. And all of these are in better eye with correction. So manifest blindness is when it is less than 1/60, and absolute blindness is when perception of light is gone. No perception of light is there. So in exam, if they give you the question that a patient is having 6/60 and 3/60 visual acuity, under which category you will put it? Most of the students, they answer that better eye is 6/60, so it will be economical. But no, economical is when it is less than 3/60. Till 6/60, this patient will go in low vision, not in economical blindness. Less than 6/60 will be economical. Okay. Wasting means banda सूख गया है, very thin guy. So the height is good, weight is less. Why the height is good? Because from the birth, the child has eaten well, but now he is not eating well. So wasting indicate acute malnutrition, and in wasting we are measuring weight for height. Okay, if weight for height is less than -3 standard deviation or -3 Z score, then we call it severe acute malnutrition, in which mid-arm circumference is also less than 11.5 centimeter, and there should be visible wasting or edema. Okay, so that there exclusive breastfeeding, we all know for 6 months there should be exclusive breastfeeding. Area per worker in factory act is 500 cubic feet, and all the area which is above 14 feet we don't consider it. So area is 500 and above 14 feet we don't measure it, because when they say 500, all the factory owner, they started making rooftop very high, and they said, see, you can count it cubic feet above space, above head also. So the guidelines say only up to 14 feet it will be counted, not above that. Folic acid, of course, it will prevent neural tube defect, and it is the only thing given in the first trimester. Not iron is not given here. Polystriator with sensory loss, it is definitely beriberi, which can be wet or dry. This beriberi is due to thymine transketolase enzyme deficiency, And in this deficiency, there will be, of course, other than this neurological thing, this is the dry beriberi they are talking, if they're talking about sensory loss. Other than this, there can be dyspnea and congestive heart failure, which will be wet beriberi. Given condition is the castle neck appearance of pellagra, which is due to nicotinamide deficiency, niacin deficiency, which is there. Condition seen in vitamin A deficiency will be Bitot spot. If Bitot spot is more than 0.5%, and night blindness, which is not in the option, but night blindness is more than 1%. In these two conditions, there are other criteria also, but these two criteria they ask. In these two criteria, in school children, you measured night blindness. If it is out of 100, more than 2 will have night blindness, or Bitot spot is in 1 also, more than 1, then we will consider that we need to give vitamin A in the whole area. If this criteria fulfilled, then vitamin A deficiency is a public health problem. Okay, so do remember this criteria, and of course it is Bitot spot which is there. CD4 count for Kaposi sarcoma is more than 350 to 500, you can say. So this question they asked last time also from this CD4 count, and this is very important to remember this CD4 count image, which they keep asking again and again. Do remember, if CD4 count is less than 200, it can lead to Mycobacterium avium complexes, histoplasmosis, and I am trying to search that image, histoplasmosis. This is a very good image given in Park, and that image will help you to answer all this question very well. Okay, let me search for this and quickly show it to you. CD4 count. Yes, this one image is there. Just 1 second, it will come. Oh, this is yes, it came. So you can see this image is the one. If it is less than 50, in less than 50, disseminated Mycobacterium avium complex, histoplasmosis, CMV retinitis, and CNS lymphoma, 4 things occur. So less than 50, only one oocyst, histoplasmosis. History is old now. So only one oocyst is less than 50. Between 50 to 200, there are all other oocysts like pneumocystosis, toxoplasmosis, cryptococcosis, coccoidomycosis, like that, and cryptosporidosis. And above 200, there is one last oocyst, tuberculosis. Other than that, all this thing, herpes simplex, herpes zoster, vaginal candidiasis, hairy leukoplakia, and Kaposi sarcoma is when it is more than 200. So how will you remember it? To remember it, first thing is, you remember tuberculosis more than 200 and histoplasmosis less than 50, because it is history. Between 50 to 200, there are all oocysts. All oocysts are between 50 to 200. And then you have to remember those who are less than 50, CNS retinitis, CNS lymphoma, disseminated MAC, and histoplasmosis. So if you remember less than 50, all oocysts between 50 to 200, then all other are more than 200. So here also it is 200 to 500 where Kaposi sarcoma occur, and the correct answer to this question is 200 to 500. So you can see there is no one option which is conforming to this 200 to 500. There is 200 to 350 also, 350 to 500 also. So when this type of debate is there, then in that case medicine will properly guide you. But you can see Kaposi sarcoma, they are writing just above 200. So I think better answer will be 200 to 350. But I cannot be dead sure about it. So I am leaving this question to medicine people. I don't know the exact correct answer, but that table can be helpful in answering such question. Paris green is a stomach poison, and it also kill larva. We have discussed it that larva is being killed by Temiphos, abate, and Paris green. 3 chemical can kill larva. Other than this, Gambusia and guppy fish can also kill larva. can eat larva, and so Gambusia guppy are eating it, and chemical which kill are these three. But Paris green is a stomach poison. It can also kill adult mosquito. It can kill both. But usually we are using using it for larva. For adult, we are using malathion, which need to be resprayed after 3 months, or DDT, which need to be sprayed after 6 months. A lot of students, they said that area outside mean plus minus 1 standard deviation will be. It was not area within, it is area not covered within. Outside or area not within mean 1 plus minus 1 standard deviation. So if they ask area within, then of course the answer is 68%, because if 100% people are included like this, then out of those 100% people, 68% people will be between mean plus 1 and minus 1 standard deviation. This area will be 68%. This. Now, if you remove 68 from 100, it will be 32%. So how many people are not within or outside? Then the answer will be 32%. Outside will be 32%. Within will be 68%. One more question they can ask from here is area between mean plus 1 standard deviation. If they ask only plus 1 standard deviation, not plus minus, that means they are only asking half of 68, and half of 68 will be 34% or 0.34. So they can ask three things from here. Covered within 68%, mean plus minus 1 68%, only mean plus 1 34%, but outside then answer will be 32%. Okay. Pneumoconiosis due to cotton fiber will be bicyanosis. In bagasosis, the causative organism is Thermoactinomycetes sacchari, and bagasosis do not just occur in sugarcane mill worker, it also occur in cardboard factory worker. In anthracnosis, we all know mesothelioma, cancer of lung pleura, is most common thing, one most common cancer which occur. And because it is of lung pleura, so they can create a clinical question here that patient in the peripheral area have lung opacification. What is the on X-ray, and he's working in asbestos factory. So that will be asbestosis, not anthracnosis. If they ask anthracnosis, anthracnosis is different than asbestosis. This is asbestosis. And silicosis is most common pneumoconiosis, in which we need annual survey every 1 year. Anthracnosis, where does that occur? In coal miner, coal factory worker or coal mine worker, anthracnosis occur. Okay. And if they ask the causative organism for farmer lung, it is Micropolyspora faini. This is the causative organism for farmer lung. Now, lady dealing with rasan soap is mixing grain with mustard oil. Whenever they say mustard oil with seeds of Satyanasi, Argemone mexicana, that means they are talking about epidemic dropsy. And in epidemic dropsy, the poison is sanguarine. How will you remember it? See, mustard oil is there. It is must, in mood. And when you are in mood, suppose, or let's say you are sleeping with someone of your dream, then you are in mood, must. So whenever we sleep, as for sleeping, as for sanguarine. And whenever we sleep, there is dropping of eyelids. So sleeping is dropsy. Moreover, the symptom is also bilateral pitting edema on leg. So pitting means it is dropping inside. Pitting edema on leg is the symptom also. So everything is related with sleeping, and mustard oil, dropsy, and pitting edema on leg. One more thing you can remember is pyrazolidine is when there is endemic ascites. So in ascites, we all know there is swelling of abdomen. Pet phul jata hai na. There is pet means abdomen in Hindi. So P for pet, P for pyrazolidine. And pyrazolidine lead to ascites, sanguarine lead to of course dropsy. Aflatoxin will be when there is history of groundnut or maize. And BOA is in neuroletharism, where will be cross leg walking on toe, and in BOA the treatment which we will give is vitamin C. Young unmarried female coming to for postcoital contraception, which type of thing you will give? Best way you will give is OCP. If OCP is not in the option, we can give levonorgestrel, because in OCP, ethinyl estradiol and levonorgestrel both are there. The dose of levonorgestrel in OCP is 0.15 milligram. The dose of levonorgestrel in I-pill is 10 times more, 1.5 milligram. But there are two types of I-pill, one in which we give 1.5 milligram one tablet, second in which we give 0.75 milligram one tablet within 72 hours, and second tablet after 12 hours. Okay, so this, all the question which I am saying with it have been asked, so do remember them. And in India, mostly we are using one tablet only. So if they see this question with this type of peripheral smear where there is this ear lobule type of nucleus gametocyte characteristic in the peripheral smear, it is suggesting us about Plasmodium falciparum. And in Plasmodium falciparum, the drug of choice can be artesunate if it is in other state, but if it is in northeastern state, then it will be artemether plus lumefantrine. They could have also given you directly banana shaped nucleus, that is suggestive of malaria, falciparum again. And if they have given you RBC with granules inside, granulated RBC is suggestive of Plasmodium vivax, for which the drug of choice is chloroquine plus primaquine, but primaquine is contraindicated in pregnancy, so we will give chloroquine only. Mother bring baby to clinic with history of night itching, examination papule and Burosine. So if there is Burosine, and or they gave the history that other family member also have it, it is definitely scabies, for which the drug of choice is 5% permethrin. Okay, so if they give other family history have it, or the itching is in inguinal area, then answer is scabies. Itch mite is the transmitting agent. And then we have done this direct association and all the question which was below it. So that's all from this session. Let me see if you have anything to say or ask from me. Anything you want to say. Okay, so headphone sept falciparum, very good. Chota doctor, medvision doctor, you all are correctly answering it. Area under covering both side, double checked, sure. So if they say area under plus minus 1 is standard deviation, then 68%. If they say area under mean plus 1 is standard deviation, then it is 34%. And if they say area outside mean plus minus 1 is standard deviation, then it will be 32%. And if they say area within mean plus minus 2 standard deviation, then it will be 95%. 3 standard deviation, then it will be 99%. Okay, so I hope you have done the MCA exam well. If you have not done it well, don't be worried. Nothing is final, and life always give us another chance. Keep working on yourself. You will be improving and doing really good in the future. And so don't be worried of anything. There is always future opportunity. Plus, the question were really twisted. It was not simple to answer. So if you got tricked, it's not only you who got tricked. A lot of students get confused in this tricky question. Thank you so much for being with me in this session. If you have anything to say or anything you want to ask or abuse me or appraise me, feel free and message me on my WhatsApp number. Thank you so much for this lovely answers and quick response.